Thank you very much. I wanted to welcome everybody here, and today the legislature will consider my private member's bill, Bill 33, the Safeguarding Our Communities Act, which is also known as the fentanyl patch-for-patch return policy. And we'll be doing that during a second reading debate. The aim of the bill is to help stem the growing abuse of a popular pain medication in communities across the province. In summary, the bill would implement a fentanyl patch return policy pioneered in my riding and roll it out in communities across Ontario to help them deal with what is becoming a growing concern in both a health, social, and criminal standpoint. In North Bay alone, at least 15 deaths have been tied to fentanyl abuse in recent years. Quite frankly, one is too many. 15 is a crisis in a community the size of ours and can't be ignored. This bill would give healthcare practitioners across Ontario greater control over fentanyl patches, which currently are being sold illicitly for large sums of money to addicts. In fact, news of the latest arrest tied to fentanyl in my hometown of North Bay is a weekly, if not daily, occurrence. I believe the approach advocated in this bill, which has already produced positive results in North Bay, is a model that will curb the dangerous and growing trend of fentanyl abuse across Ontario. I'm pleased to be joined today by the North Bay and Area Community Drug Strategy Committee Chairperson, Patricia Cliche, sorry, Pat.
It's okay.
Patricia Cliche, and Detective Constables Brad Reaume and Tom Robertson from the North Bay Police Service. Now, they played a critical role in developing this legislation. Quite frankly, it may be my bill, but it's really their bill. These are the people who have worked so hard to develop this legislation, put it into practice in North Bay, and its success, ultimate success, will be contingent on rolling it out across the province, and you'll hear why. I also want to acknowledge Carleen Varayan of RBP Canada, who is here and has been very supportive of the bill. Now I'm going to ask Patricia to talk about her thoughts on this bill.
Thank you very much. We are very pleased at the outcome of our initiative in the District of Nipissing and really throughout the province of Ontario. Since we have initiated this protocol, I'm pleased to say as of today, as far as we know, 22 communities in Ontario have initiated the patch-for-patch protocol. And 17 are in the process of initiating the patch-for-patch. The Ontario Chiefs of Police have it now on their website, and 3 other communities are looking at initiating this protocol. It was quite easy for us in North Bay to initiate it when the 2 gentlemen on my left came to me and said, "We've got a problem in North Bay. Do you think you can help us?" They came to me in September, and by December the 6th, we initiated this procedure. It came together quickly. In all my years of working in healthcare, nothing has ever come together that quickly. It's done in strong partnership with the police, with our pharmacists, and our physicians. And I have to say our pharmacists are great gatekeepers of this program. They work very hard ensuring that the physicians stay intact with how many fentanyl patches are given out, and they are a great, great partner. The other thing is that people are calling all the time saying, how do we go about doing this? And we share our protocol to whoever in the province wants it. But I think that this bill will assist people saying, oh, this is a great thing. So since we ask people to tell us who can we contact to get this bill? We've sent the bill out to everybody, so they say, we hope it becomes mandatory, because then it makes it easier for us to initiate it in our community. But I'd like to turn to Brad or Tom to say what has happened in our community as far as what has made a positive impact in our community.
So in December of 2013, the North Bay and area implemented the regional patch-for-patch policy. And what that did, it requires an individual who's prescribed fentanyl to return that prescription to the pharmacist before they receive their new prescription of fentanyl. We found through doing drug investigations that illicit fentanyl is obtained through legitimate prescription holders. In North Bay, a 100 microgram patch can sell for $400. When they consume it illegally, they do it through ingesting it, injecting it, or smoking it. Smoking it is the most common method. Once the patch is smoked, it's gone, so nobody can get that patch back. A person that's prescribed it legitimately places it on their arm for 3 days and can actually remove it and has the ability to return it to the pharmacy. So this prevents an individual who may be tempted by the high financial gain from selling their prescription. This prevents them from actually selling it to illegitimate users. What we noticed immediately was there was an increase in the cost of fentanyl in North Bay, so they're now selling up to $600 per patch. The availability is almost non-existent within the community, and we are hearing of situations and cases where people are leaving the community to attend other communities that don't have a return policy in place to purchase fentanyl from legitimate prescription holders to bring back to North Bay and sell. One individual that we arrested had 60 fentanyl patches that came from the Greater Toronto area. We believe this to be a legitimate prescription or several legitimate prescriptions, and they were brought back for the purpose of sales in North Bay.
One thing I could add to that is one of the issues that we found after we implemented the program was people were actually making counterfeit patches. They were buying tape and cutting it out in the shape of fentanyl patches and returning the tape. We've since spoke with the pharmacist, made them aware of this, and they're more diligent in checking to make sure that the fentanyl that's being returned is actually fentanyl and not fake patches.
Well, thank you, everybody. Look, this is going to be a wonderful opportunity to turn the tide on illicit drugs today, and I'm certainly looking for all party support on this afternoon. We'll be speaking in the legislature, all three parties, for about an hour at 2:30, and at 4:30 we'll be standing up to vote in favor of this Bill 33, the fentanyl patch-for-patch program. Thank you, everybody.